Do you remember the last time you slept through the night without waking up because of your hip? Without having to keep switching sides in bed because that lateral pain will not let you? Without waking up already tired because your sleep was interrupted by pain? And during the day, it is not much different. You go up a flight of stairs and feel that throbbing pain on the side of your hip. You stand for longer than you should, and your hip starts to complain. And there are days when the pain radiates along the entire side of your thigh, like an electric wire. If you recognized yourself in any of these situations, I need to tell you something. This pain has a name. In most cases after 60, this lateral hip pain is linked to bursitis, an inflammation that appears when the muscles around the hip are weak and overloaded. And the good news is that it responds very well to the right exercise, done the right way. As a physiotherapist with more than 10 years of clinical experience, I guide my patients to perform a sequence of simple stretches and exercises at home that makes a real difference in this pain. And almost no one talks about it. Today, I am going to show you 5 exercises. Each one prepares your hip for the next. And number 1 is the one I use in the clinic and that rarely appears in videos out there. Stay until the end, because after the exercises, I will reveal the daily habit that most people with hip pain have and that keeps bursitis inflamed without realizing it. Let me explain something important that you probably do not know. Place your hand on the side of your hip now. Rub it slowly. You will feel a very prominent bony bump there. That is the greater trochanter, the part of the femur where several muscles meet. And exactly in that region, between the tendons and the bone, there is a small protective sac called the bursa. It is thin, slippery, and serves to prevent friction between all the structures that move there. The problem happens when this bursa becomes inflamed. And the 2 most common causes after 60 are exactly the ones we are going to fix today. Muscle tension, which increases the pressure on this sac, and muscle weakness, which misaligns the hip and causes the tendons to rub where they should not. That is why the pain appears on the side. That is why it gets worse when you lie on that side. That is why it throbs when you go upstairs, when you stand for too long, or when you take those first steps after sitting. And the solution is simpler than it seems. Stretch what is tight and strengthen what is weak. That is exactly what we are going to do today. In that order, for a very clear clinical reason. Because stretching without strengthening relieves the pain for a while. But strengthening is what truly protects the hip. And before we start, let us make an agreement. Mild muscle discomfort can happen. It is a sign that the muscles are being worked. But sharp pain in the hip should not. If that happens, reduce the range, use more support, and go back 1 level. The goal here is safe progress, not suffering. Tell me in the comments, does your hip pain get worse at night when you lie down or during the day when you move? I read and reply to all comments. It helps me get to know you better. Now that you understand what is happening in your hip, let us fix it. 5 exercises, from number 5 to number 1. Each one prepares your body for the next. Let us start with the gentlest of them all. Exercise number 5, knee to chest. Before any strengthening, the hip needs to be mobilized. When the joint is stiff and the tissues around it are tight, any strength exercise will face resistance. This movement prepares the ground for everything that comes next. And there is more. This knee to chest hug gently stretches the hip joint capsule, that structure that surrounds the joint on the outside. When it is stiff, the bursa suffers more friction. When it is looser, the hip moves with much more comfort. To do it, lie on your back on a firm surface with your legs extended. Bend one knee and gently bring it toward your chest, hugging it with both hands, one on the shin, the other on the back of the thigh. Pull slowly until you feel a comfortable stretch in the hip and glute area. Hold for 30 seconds. Breathe. Consciously relax the muscles with each exhale. Then switch sides. 2 very common mistakes. Lifting your head and neck to look at what you are doing. Your head stays relaxed on the floor. And pulling too hard. The movement is gentle, never painful. Do 3 repetitions of 30 seconds on each side. Exercise number 4, piriformis stretch. If the previous exercise mobilized the hip in a general way, this one goes straight to the muscle that causes the most trouble in cases of bursitis, the piriformis. It sits deep in the glute, right behind the hip joint, and when it is tight, it presses exactly the region where the bursa is inflamed. It is one of the biggest silent villains of lateral hip pain, and one of the most ignored. The good news is that it responds very well to the right stretch. To do it, lie on your back with your knees bent and your feet flat on the floor. Now cross the ankle of one leg over the knee of the other, as if you were sitting cross-legged but lying down. You will notice a triangular space forming between the two legs. With both hands, reach through that space and hold the back of the thigh of the leg that is resting on the floor. Now gently pull that leg toward your chest. When you do this, you will feel a deep stretch in the glute and on the side of the hip of the leg that is crossed. That is exactly the piriformis being stretched. Hold for 30 seconds. Breathe deeply, and with each exhale, allow the stretch to deepen a little more, without forcing it. The key is to keep the ankle well supported on the knee throughout the entire movement. If it slips, the stretch loses focus and shifts to the wrong place. Two very common mistakes: tensing the shoulders and neck while pulling. Completely relax your upper body. And pulling too hard all at once. The muscle needs time to release. 30 seconds of a gentle stretch is worth more than 10 seconds of forcing it. Do 3 repetitions of 30 seconds on each side as well. Exercise number 4, iliotibial band stretch. This is one of the most important stretches for those who have lateral hip pain, and one of the most ignored. The iliotibial band is a firm strip of tissue that runs along the entire side of the thigh, from the hip to the knee. When it is tight, it pulls directly on the region of the greater trochanter, exactly where the bursa is. And this continuous traction is one of the main reasons why the inflammation refuses to go away. To do it, lie on your back with your legs extended. Wrap a resistance band, a towel, or a folded sheet around the sole of the foot of the leg you are going to stretch. Hold both ends with your hands. Now, keeping the leg completely straight, without bending the knee, pull that leg across your body toward the opposite side, as if you were taking your foot to the other side of the bed. The shoulder on the same side stays glued to the floor the entire time. You will feel a deep stretch along the entire side of the thigh, from the hip to the knee. That is exactly the iliotibial band being worked. Hold for 30 seconds. Breathe deeply. And with each exhale, allow the leg to move a little further to the side, without forcing it. 2 very common mistakes: bending the knee to get the leg further across, reduce the range, and keep the leg straight, and pulling too hard all at once. The iliotibial tissue is dense and needs time to release. Do 3 repetitions of 30 seconds on each side. 3 stretches done. The hip is looser, the bursa has less pressure, the tissues are prepared. Now it is time to build the strength that will support all of this. Let us move on to number 3. Exercise number 3, glute bridge. Now we enter the strengthening phase, and I start with the gluteus maximus for a very clear reason. It is the largest muscle of the hip. When it is weak, the entire joint loses stability, and the bursa continues to be overloaded even after stretching. Strengthening this muscle is what turns temporary relief into lasting results. Lie on your back with your knees bent and your feet flat on the floor at hip width. Before lifting, squeeze your glutes consciously. Now push through your feet and lift your hips slowly until you form a straight line between your shoulders, hips, and knees. Hold for 2 seconds at the top while squeezing your glutes, then lower slowly with control. The key is to feel the glutes working, not the lower back. If you feel it more in your lower back than in your glutes, reduce the height and focus on the squeeze before lifting. When it becomes easy, add a resistance band above your knees and gently press outward during the entire movement. This activates the gluteus medius even more. Start with 10 to 12 repetitions, 1 to 2 sets. Exercise number 2, clamshell. If the previous exercise worked the gluteus maximus, this one goes straight to the gluteus medius, the muscle that stabilizes the hip laterally. It is exactly this muscle that is weak in most people with bursitis. When the gluteus medius does not do its job, the hip loses alignment, the tendons rub over the bursa, and the lateral pain returns every time. Lie on your side with your hips slightly bent and your knees bent in front of you. Keep your feet together. Without rotating your torso backward, slowly open the top knee like a shell opening. Lift only as far as you can without letting your hip rotate backward. Hold for 1 second at the top. Then lower with control. The key is to feel the work on the side of the hip, not in the lower back. If your hip is rotating backward to help lift the leg, reduce the range. Smaller and correct is far more effective than higher and compensated. When it becomes easy, add a resistance band above your knees to increase resistance. Start with 12 to 15 repetitions on each side, 1 to 2 sets. Your hip now has the support it needs. It is time for number 1, the most important exercise in this video. Stay with me. Exercise number 1, standing hip abduction. I left this one for last for a very clear reason. Everything you have done so far has been preparation for this moment. The stretches reduced the tension on the bursa. The bridge activated the gluteus maximus. The clamshell woke up the gluteus medius. Now it is time to bring all of this into a standing position, literally, and train the movement your hip uses in real life. Think about it. Every time you take a step, go up a flight of stairs, or simply stand on one leg while putting the other into your pants, the gluteus medius is working to keep your hip stable. When it is weak, the hip drops to the side, the tendons slide over the bursa in the wrong way, and the lateral pain appears. This exercise trains exactly that stability, standing with body weight, just the way real life demands. To do it, stand next to a sturdy chair or a wall. Lightly place one hand for balance. Shift your weight onto one leg. This one stays slightly bent and stable. The other leg stays extended and relaxed. Now, without leaning your torso to the side, lift that extended leg out to the side. Slowly, with control. The foot points forward the entire time, not upward. Lift as high as you can without letting your hip rise along with it. Hold for 1 second at the top, then lower slowly, without letting the leg drop. The key is to keep your torso completely stable throughout the movement. Think of it this way: your body stays still, only the leg moves. 2 very common mistakes: rotating the foot upward during the movement. The foot points forward the entire time. This ensures the focus stays on the gluteus medius. And leaning the torso to compensate, reduce the range and keep your body stable. If it becomes easy, add a resistance band above the knees or at the ankles to increase resistance, but only when the movement is fully controlled and pain-free. Start with 10 to 12 repetitions on each side, 1 to 2 sets, 3 times per week on alternating days. And remember our agreement: mild muscle discomfort can happen. Sharp hip pain should not. Now let me show you how to fit this sequence into your week. Do these 6 exercises every morning, exactly as the title promises. The full sequence takes just a few minutes. Why in the morning? Because that is exactly when bursitis bothers you the most. The hip spends hours in the same position during sleep. The tissues become stiff, and the first movements of the day are the most painful. Doing this sequence early is like giving your hip the warm-up it needs before facing the rest of the day. In the first week, focus on learning each movement with control. No rush, no forcing. In the second week, try small progressions. Hold the stretches longer. Add resistance bands to the strengthening exercises if it feels easy. How will you know it is working? The first steps in the morning become less painful. The pain when lying on your side decreases. The hip starts to feel more reliable throughout the day. No miracles, just real, consistent progress. Now for the bonus I promised at the beginning. Let me ask you something. How do you sleep at night? Because if you have hip bursitis and sleep on your side, especially on the painful side, you are spending hours compressing the inflamed bursa directly against the mattress, night after night. And then you wake up in more pain than when you went to bed, without understanding why. This is the habit that keeps bursitis inflamed even when you are doing everything right during the day. The solution is simple and makes a difference from the very first night. Place a firm pillow between your knees. This pillow keeps your hip aligned, reduces pressure on the bursa, and distributes your weight better during sleep. It is a small adjustment, but for those with bursitis, it completely changes the quality of rest. One pillow, a better night. And combined with the exercises you learned today, a real difference in lateral hip pain. I have an important warning. If your hip pain is very intense, is getting worse over time, or is accompanied by significant swelling, a feeling of instability, or strong radiation down the leg, the best option is to consult a doctor or a physiotherapist for an individualized evaluation. There are other causes of hip pain beyond bursitis, and there are also levels of inflammation that sometimes require different treatments. And if you want to go beyond what we covered today, I left 2 options in the pinned comment that can help you on this journey. The first is a complete exercise program, organized step by step, for you to follow at home at your own pace. The second is a natural supplement developed specifically for joint health and to help reduce inflammation. Take a look at the pinned comment and see which one makes more sense for you right now. If this video helped you, tell me in the comments. What has hip pain already prevented you from doing? And what do you really want to get back to doing? It could be a walk, a trip, playing with your grandchildren, sleeping through the night without waking up in pain. I read everything, and knowing this helps me bring more useful videos for you. If you want to keep taking care of your body with simple, safe exercises designed for real life after 60, subscribe to the channel. Every week, there is new content just like this. And in the next video, I will show you the best exercises to strengthen your legs after 60. Because when your legs are strong, your hip and knee work much better together. See you there.